Hello, everyone. Go ahead and get comfortable. We'll get started in just a moment. All right. Hello, everyone, and thank you for joining us tonight for History Happy Hour, awaiting the polio vaccine. My name is Mary Ann Sheeline, and I serve as the Director of External Engagement and Special Initiatives at the Indiana Historical Society. It's so great to have so many of you here this evening. I will be going over a few logistics before passing the mic over to our speakers. At the Indiana Historical Society, we are Indiana's storyteller, connecting people to the past. We collect paper-based items such as books, paintings, letters, photographs, diaries, maps, and more to tell Indiana's unique stories. We then find ways to share these stories through publications, exhibits, and events such as this. Through these documents, we tell the diverse stories of Indiana and inspire a future grounded in our state's uniting values and principles. Tonight, as we continue to experience the COVID-19 pandemic, we are going to take a look at a time when Hoosiers mobilized to eradicate another viral disease, polio, in 1955. But before I introduce Dan and Michelle, I have a few pieces of logistics to go over. For this event, Dan and Michelle will talk for about 35 minutes, and then we'll open it up to your questions. If you have questions as we go along, please drop it in the Q&A section of your Zoom screen. We'll keep an eye on them and then pepper them in as we get to the second half of the program. If you would like to add anything to the chat box, don't forget to change your response to all panelists and attendees so that we can all see your thoughts. Keep an eye on the chat where I will be dropping in links and URLs throughout the conversation. And don't worry if you miss one, they will be delivered to your inbox in a follow-up email tomorrow morning. This program is being recorded. You can catch the replay on our website, indianahistory.org, in the upcoming weeks. If you enjoy this program, please consider coming back for more. Our History Happy Hours continue next week on April 29th with Racing for Equality with Beth Peretta of Peretta Autosport. And stay tuned for upcoming conversations on the WPA in Indiana, Indy 500 Princess Program, and more. Sign up for all of those at indianahistory.org for more information about this and other virtual offerings coming to an internet-connected device near you. And now I'm going to turn it over to Dan Shockley, Creative Director for Exhibitions and Audience Experience at the Indiana Historical Society. Dan joined the Indiana Historical Society staff in 2007 as they prepared to open the Indiana Experience exhibit program, and he is currently the Creative Director for Exhibitions and Audience Experience. His work in the Indianapolis theater community, both on stage and off, combined with his 20+ years in the museum field, all add up to his unique approach to audience connection and experiential learning. Before coming to the IHS, he previously worked at both Conner Prairie and the Indiana State Museum. Take it away, Dan.
Good evening, everyone. Welcome to the happy hour. I am going to introduce my friend, Michelle Jarrell. And Michelle served in the U.S. Air Force before attaining dual bachelor's degrees in history and political science. Michelle also has a master's degree in history from Ball State University and a master's of library science from Indiana University. Previously a department head and assistant professor of library systems at Indiana State University. Since 2006, Michelle has worked for Eli Lilly and Company as librarian, historian, archivist, and museum curator. In 2012, and this is where we met, she was a member of the advisory committee for the You Are There 1955 Ending Polio exhibit at the Indiana Historical Society, where we examined the production of Jonas Salk's polio vaccine in Indiana. So I want to welcome you, Michelle. And since it's happy hour, I want to ask you what you're having to drink.
Well, I should have a big old glass of wild cherry Kool-Aid, but unfortunately it's just water tonight. I say that it should have been Kool-Aid because that's actually what we use to replicate the color, the look, and the feel of the vaccine or the polio vaccine for the You Are There experience. The scientists who recreated the vaccine actually had quite a time, I guess, coming up with the proper formulation of red that would match the original vaccine. So I can't remember how many packets of unsweetened wild cherry Kool-Aid per liter it took, but they figured it out, and I'm sure there's a note somewhere in a chemist's logbook about it.
Well, your company for us filled about 6,000 little vials of fake polio vaccine for that exhibit.
I remember it quite well, actually.
I'm sure. Well, I'm having a drink, but more importantly, it's the glass that I love. It's polka dot. It was a set my sister had, and every time I went to her house, I got the pink one. And over the years, the other three colors have all broken. So this year, she gave me the pink one.
Oh, that's a great story.
It was. So you're the archivist for Eli Lilly, among other things at Eli Lilly Company. Tell us what that means and why is it important for a company like Lilly to have an archivist and have an archive?
Sure. So, people often ask me, they literally do ask me, what do you do at Lilly? They find out I'm at Lilly, and Lilly is so well known in the city of Indianapolis that, it instantly kind of brings that kind of question to the forefront. And quite frankly, if you ask anybody who works at Lilly what they do, they'll give you a title or something, and that means, absolutely nothing to anybody who, hears that that's what you do. So then you have to ask the question, well, what is it you actually do? And so archivist is actually a profession, a sub-profession within librarianship. It's a special library. It's essentially a library of old things, and it can be a library of, any number of types of things. And so what that means at Lilly is it's documents, it's photographs, it's film, it's three-dimensional items such as old product, tchotchkes that were given away by the company over the years, things like that. The actual genesis of the archive goes back to one of the founders of the company. The Colonel, of course, founded the company in 1876, but his son was very much interested in history himself. So that's Joseph K. or J.K. Lilly Sr. And of course, Mr. Eli, his eldest son, was president of the Historical Society. So he was very obviously involved in history as well. And so they understood the importance of history to the local community. They understood I think that they understood or wanted to understand that they were an important part of the community. And quite frankly, I think that has proven to be the case over the 140 plus years of the company's existence. And so in J.K. Sr.'s reminiscences, which he did about 1940, he actually suggested that there always be an archive of things, a collection of things from the family that would be compiled and put into an archive. Now, fast forward to a couple of years, a year or so actually, after his death in 1948, there was a call throughout the company for people to bring materials of relevance to the company and to the family, and create an actual real archive for the company itself. And so since 1949, there have been, I think I'm the 5th archivist for the company. So it's a position that somebody takes on for a number of years typically. We preserve our company's past. We actually also serve as the archivist for the family and historian for the family. And so we collect materials not only for the family, but also for the company. And we use those in any number of ways, supporting community activities such as this. We use them obviously for business activities. I think you'd be amazed at the number of ways in which various parts of the company engage with me for the services of the archive. It's just a long running thing. And it's incredibly important that, the company remember its history, simply because, there are these flashpoints, there are these watershed moments throughout our history wherein, we tell a story, and we have a story, a very important story to tell, not only, again, for the lives of the people we touch through our medicines, but also through the company's history and philanthropy and all of those kinds of things.
Wow. So on the screen there, we're looking at a picture from the archive, your archive, and how we used it. As you said, many, many kinds of people and institutions use your archives. We're certainly one of your customers. And we use the picture there on everyone's left. Can you tell us a little bit about what's happening in that photograph on the left, the black and white?
I certainly can. So in the lead up to the launch of the vaccine in 1955, the company was actually, before it was even approved, the company was ramping up production and pursuing the actual manufacture of the supplies that would be used for vaccinating people across the United States. And so what they did, and I don't even know that everybody knows this part of the story, there was at one point a film crew that was brought in order to document the process from beginning to end in terms of how the vaccine was created, how it was made, how all of the processes involved. And the photograph on the left is actually incorrect in that it's posed. It's actually a posed photograph. I don't know if you remember that part of this, but the workers there that you see to the left or to the right of the conveyor belt are actually on the opposite side of the conveyor belt in which they would actually have worked. They would have been on the right or the left side of the conveyor belt, but they are the finishing line of the process. In other words, they are the packagers. They're the people who put the vials that are in little boxes into bigger boxes, which then fit into larger boxes than that. And then those rush boxes that you see there are the ones that are shipped off to various locations for administration and those kinds of things. So you're seeing kind of the end of the line of that manufacturing process here.
And so there on the right is the photograph of our actors at the Indiana Historical Society in our recreation, where we told the story of manufacturing and packing and shipping the polio vaccine. In addition to the workers that you see there, we had an actor playing Mrs. Diener, who was with the March of Dimes before it was called March of Dimes, or the main title.
Right.
Yeah.
National Foundation for Infantile Paralysis.
Yes. And you could come in, as you can come in now. We have 3 You Were There exhibits open right now. You could come in and speak to those actors and learn a lot of the things we're going to talk about tonight, actually.
Right.
You, Michelle. But so this is 1955. Let's take a step backwards and talk about how did the Lilly company come to medicine? How did the company begin?
Sure. The company was founded 1876, May 10th to be exact, by Colonel Eli Lilly, very well known by most people in central Indiana, and for good reason. He had really quite an amazing life, and he was very important to, the city of Indianapolis. Most people probably don't know that he was the first president of what became the Chamber of Commerce in Indianapolis. And back then it was called the Commercial Club. But this is the little building here on the left is from about 1877, 1876 or 7. I think it's 87 or 77 rather, simply because of what it shows. But that is the little Pearl Street location where Colonel Lilly founded what became Eli Lilly and Company. The photograph there on the right is a copy of it's actually a real copy of the first price book for the company that was actually produced in 1877 as well. And so the Colonel was a pharmacist by trade, by not only education, but also through an apprenticeship. And so before the war, pardon me, he owned and operated a small pharmacy in Greencastle, Indiana, and moved on to become embroiled in the Civil War, of course, where he went in as a captain and eventually became Colonel Lilly by the end of the war, and then he left and did a number of things and came back to Indianapolis around 1875, founded a small manufacturing facility with a dentist in town, and then ultimately founded Eli Lilly and Company in 1876, and that's what that looks like. A lot of people probably have a lot of stories or a lot of misconceptions about what medicines were back in those days. They weren't, they certainly were not modern concoctions, right? And so what you see in that little price list are things like fluid extracts. They're made of roots and flowers and berries and barks and anything natural that occurs naturally. Sugar-coated pills of one form or another. I know you've seen the pill drawers in the archive. I always kind of joke that there's enough strychnine and that kind of stuff to, kind of make a person scared, quite frankly. But that's what medicine was back in those days. They were not necessarily as interested, or I'm sure they would have been interested had they known, but, germ theory wasn't exactly widely accepted at that time. And so you have things that really kind of mask symptoms rather than, cure disease, as we try to do today with antibiotics and those kinds of things. Moving forward, in time, you end up with other various medicine types of things. For example, in 1884, something is introduced called succus alterans, which was, by every account, by every description, a patent medicine. One of the myths that we have about the Colonel is that he never sold patent medicines. And I always say that was patently incorrect, because quite frankly, that's what medicines were back in those days. And so Dade's succus alterans was given for everything from syphilitic conditions to other things. And you can imagine it, really didn't control the disease state, right? It's not an antibiotic. by any stretch of the imagination. So, those are the kinds of things that are sold during, pardon me, the colonel's lifetime and his, as he was president of the company until his death in 1898. Of course, the watershed, the huge watershed moment for the company is 1923, October 15th to be exact, when it launched Ileton, which is our insulin product that we sold from 1923 all the way up into the early 2000s. But there are a number of other products, obviously, that we've sold through the years. Liver extract for pernicious anemia, for example, penicillin G. We were one of the largest manufacturers of that for the war effort. All kinds of, for those people in the audience who are acquainted with Lilly products in the 70s and 80s, you would know us as a huge anti-infective, expert. And so, there are things like that that we've made, and not only made, but invented over the years, much to the credit of our scientific efforts.
So by the time we get to the polio vaccine in 1955, the company's been in business for almost 80 years.
That's right. Absolutely. Yep.
Okay. So let's go to the 1920s, 30s, 40s. Can you paint us a picture of polio in America before the vaccine?
Yeah. So, the polio itself actually is described in literature going back at least to the 1800s. So, there is some understanding that it exists. Of course, they wouldn't have understood it to be a viral condition simply because there's no true scientific understanding of what causes these things. They probably thought at some point it was bacterial, because bacteria was, one of the first things that we start discovering once we have the microscopes associated with, being able to see those kinds of things. I know Robert Koch, or Koch, however you pronounce that, he was, obviously responsible for really producing an understanding of how the bacterial activity in the human body. For example, he discovered the tubercle bacillus that causes tuberculosis. And so, what you see is a number of attempts to deal with this condition as it ebbs and flows throughout the years. At one point, people actually fogged for mosquitoes, thinking that mosquitoes may have transmitted it. They just knew that it was associated with the summer months. And so, the race was on from a research perspective to understand what the mechanism was. And finally, you have some understanding, into the 30s and 40s of exactly what that is. Probably in large part because of the work of the, what becomes the March of Dimes, the infantile paralysis National Foundation. And so what you see by the time Jonas Salk is introduced into the conversation, he has theories about we already understand there's a mechanism there that's viral, and so then the race is on for trying to find a vaccine that would work against it in a real sense. So what that looks like, if you want to look at it from the annual kind of uptick in terms of deaths associated with polio and those kinds of things, let's just look at 1 year, 1952, and this actually is not the worst of the years in Indiana. But 1952, the polio epidemic swept through the United States, resulting in 50,000 reported cases with 3,000 deaths and 21,000 victims being paralyzed. So, that is, at the time, a considerable problem to face, especially since, these victims were young, very often young children, and these infections took place during the summer. And so, what do you do with your children in the summer? Especially back in those days, send them out to the water hole, you send them out to wherever it is they swim, and they come back potentially infected with this horrible disease that left them potentially paralyzed or deceased. So it was a serious problem.
My parents were married in the late 40s, and my father's youngest sister contracted polio around 48, 49. And so, my mother tells stories about helping her with her exercises and things of that nature,
Right.
In order to try to help her with her muscle mass and her legs and
Right.
things like that.
Right.
What was kind of the general feeling about polio, and when was the largest outbreak in Indiana?
I think generally speaking, it was terrifying, right? I think that as parents, myself being a parent of two young children, parents, especially in the 50s, the early 50s, sequestered their children through the summer months, especially leading into, let's say, 52, 53. 49 was one of the worst years, but was bested actually in 1955. Or 1954 rather, that had in Indiana 1,448 cases. And so, you see what at least it appeared to be this upswing in the incidence, contracting the disease. And so, by 1955, people were terrified, quite frankly, to let their children out and, do what all kids do, quite frankly, and be out and about and doing their things. Children were probably more prone to infection because of the way in which it reacted, the way in which they contracted the disease. A lot of adults didn't go swimming and those kinds of things, whereas children were out there doing that. And so since this was a waterborne and it involves a viral component that is transferred through the mouth. It's a situation where, hygiene and all of those kinds of things are preventative, but certainly not assured, especially in a swimming situation. So pools were being drained on a regular basis. It was really quite scary for those people who were living through that period. And like you said, most people knew somebody or knew of somebody who had contracted the disease. And so, it's not like it was that far away.
So here we are in hopefully nearing the end of COVID-19 with vaccines going out. And, we hear every day the words anti-vax or vaccine hesitancy. What kind of vaccine hesitancy was there surrounding the polio vaccine?
It's kind of hard to find evidence to support any measure of hesitancy. As I was looking through the archive, one of the things that we have any number of are letters from people who thank the company, right? And so one of the things that I discovered through my meandering of the materials was this very interesting letter written to Dear Sir, right? I mean, they have no idea who they're trying to contact, but it ends up, on the president's desk at some point in time, and then it ends up in the archive after that. Mm-hmm. And so in this letter, let me just read some of this letter. It's a fascinating kind of look at, hold on just a second here. Dear Sir, enclosed is a clipping from our newspaper. Why not check public opinion instead of increased supply, et cetera, et cetera, et cetera. We have 2 children. They just finished having their series of 3 shots. Of that, we are very proud. So this was actually something to be proud of, at least for these parents. But you don't know what anguish went into the decision. They talked with their doctor, they consulted with their minister, and then they returned to their doctor. And in both situations, they were reassured that they we were reassured that we weren't giving both our children polio, which was, I guess, a concern that they had. We had the virus, we had the series of shots, and now we, my husband and myself, are ready to start. So we will finish by polio season, which would have been the summer months. My belief is, and then she goes on to talk about the fear that other people express. And to that, she says, my belief is, it is fear. Fear that you are giving your child a deadly disease, deadly injection. Next is financing. And last, the I don't care group. And so then she goes on to talk about her own rationale and the fact that, that her children's health and future without polio was way more important than any of these misconstrued concerns that she had with regard to actually vaccinating her children. So I think that's very relevant when we want to think about, the fears, the types of fears that go into these kinds of things. It's science over irrational fears, quite frankly, and it was at that time. And I'm not going to weigh into the COVID-19 controversies myself. I will say that I've received two vaccines, 2 shots for the COVID-19 pandemic, and quite frankly, I'm very glad and hopefully that the people around me are all vaccinated and that we can move forward with our lives, unfettered by the problems associated with hospitalization and those kinds of things. Quite frankly, I am personally very scientifically minded. I'm interested in science. I work for a scientific company, and I can speak for myself and say that I'm glad it's there.
Thank you. Okay, so now we're at 1955. There's been vaccine trials going on for the polio vaccine. It's looking good. The data has been looking good as we get to it. So the vaccine is almost ready to be distributed, approved, then distributed. What's the Lilly company doing right now?
The company is ramping up production, quite frankly. They were involved in, they were one of 5 companies that were asked to make the vaccine. And we gladly jumped aboard. So the trials that took place in 53 and 54 were there. And we were supplying vaccine for those. Long before the vaccine was approved, our president, Eugene Beasley, made the decision that the company, Lilly, would actually ramp up production and have it ready so that as soon as it was approved by the National Institutes, that we would release it to the public. And that's exactly what they did. That's Beasley there on the left, and an actual vial of the vaccine, of the Salk vaccine, on the right there.
It was quite a gamble, wasn't it?
I'm sorry?
It was quite a gamble, wasn't it?
Oh, absolutely. We're talking about millions of dollars. I have a quote here from the head of biological medicines at the time. And he said, and this is Clyde Culbertson, who was head of Lilly's biological research at the time. He said, few men would have had the courage to do what Gene did. Speaking of Eugene Beasley, if things had gone wrong, the company would have lost millions. And, this is in 1955 when millions of dollars would have been a considerable loss, right? I think people often don't understand that in order to get something like this into production, not only were we dealing, so when somebody invents something, so when Salk invents a thing, he invents a little tiny bit of it, right? And so it goes through tests and they ramp up a little bit of, manufacturing capability just to test it. But in order to scale that up to industrial levels, it takes a huge amount of investment, not only in, we had to build a building, for example. We had to invest in the infrastructure. We had to do all of the things, procuring the raw materials. There are over 60 materials that went into the growth medium that the virus was grown in, right? And so all of this stuff is considerably expensive. And not only would that program have been bust in terms of the millions of dollars lost from all of that procurement and logistics, but we also would have wasted a number of other materials. So and the antibiotics that were used to keep bacteria out of the growth medium, and all of those kinds of things that went into the the production of the vaccine. On top of all of that, you've got people, not only researchers, but manufacturing specialists and finishing and filling, transportation, and all of these other logistical kinds of pieces that fit into this thing, the manufacturing of this product that come into play that are wasted and could have been doing something else if it doesn't move forward. So, when you start wrapping your head around exactly what that means for a company, it's, a substantial potential loss for the company to do what Eugene Beasley did.
So, we're talking today about the heroes and heroines producing and distributing and giving vaccine now. Really, it was the same then at the company and many other places. The Dorothy and Janie's working on the shipping line, the packing line.
Absolutely.
Heroes of their day, helping to combat something truly horrific.
Yeah, absolutely. And people were affected by the manufacturing of the product. I know of at least one woman who died during the manufacturing process as a result of some mishandling of materials. Her death actually left her son an orphan. The company actually stepped up and ended up, taking the child on as kind of a ward. I'm sure that he lived with whoever he lived with, but he sent the child to college, and ultimately he ended up working for the company himself. And so, it's no simple thing when you work with these materials that can cause that kind of infection and death. And so, it's something to be taken very seriously, and the company did so.
Did the company run into any problems in the packing, shipping, getting the vaccine out to where it was needed?
I had to think about this one for a little while. There was a problem, not from Lilly's perspective, but from one of the other, suppliers. The Cutter Labs from California, they actually shipped out a huge amount of vaccine that ended up resulting in thousands of infected people. And so, as it turns out, the virus that was in the Salk vaccine was attenuated. In other words, not attenuated, it was inactivated. And so it was dead virus that was injected into the person, the recipient of the vaccine, that was then used by the body to build immunity to the virus itself. And so it was essential that the materials be tested properly, and really the way you do that is through microscopic observation of each and every jar of, there were these huge flat jars. In fact, there's a picture of one on the right side. There were these huge jars that had to be screened via microscope in order to make sure that the virus was dead before it was bottled and sent off for use. And that didn't happen in the shipment from Cutter Laboratories. And so, that's the gamble you if you're not doing something the way it's supposed to be done. And so, their lives are at stake in that moment. And so you take that extra piece of caution. You've got checklists of safety protocols and those kinds of things that are enacted and are strictly adhered to, or else you could have a catastrophic effect. There was one instance that I can recall where a batch of vaccine had to be destroyed from Lilly. I forget exactly the reason, but people were quite angry because they were waiting for their opportunity, much like with the COVID-19 vaccine. They were waiting for their own opportunity to receive the vaccine, and so here they hear about Lilly destroying vaccine doses, and they're upset about it, and in some ways rightfully so. But there was a problem with that particular that set of vaccine, and so rather than give somebody bad vaccine, you throw it away, you destroy it.
So let me ask one more question before we move into the question and answer, which we're getting several. So today we see celebrities, Dolly Parton, chief among them, saying, "Hey, everybody, go get a vaccine." What kind of celebrity support was there in the 50s for the polio vaccine?
Yeah, during that period, obviously, some of the big names in showbiz that were involved would have been Elvis and Marilyn Monroe. Really before his death in 1945, the biggest promoter of, work in this area, though, would have been FDR. So Roosevelt himself had contracted polio decades earlier. Many people didn't realize that because you never saw him standing, right? He was always seated in one way or another. But he had contracted polio, I think, as a 39-year-old. And, as a result of his own, infection, he was very much a proponent of the National Foundation for Infantile Paralysis and, what would become the March of Dimes. And many people today probably don't realize that he's the face on the obverse of the dime simply because of that connection to the March of Dimes.
That's
so, cool. Before that, in 1945, the dime is the Mercury head dime. But in 1946, you have a changeover to the Roosevelt dime for that very reason.
Wow, that's great. And you saw Hugh Jackman there a second ago getting his COVID vaccine, and I don't know that you can beat Marilyn Monroe about the polio vaccine. So we've gotten a bunch of questions from our audience. So let me ask you a few. One question is, did the polio vaccine have to be kept cold like the COVID vaccine?
No. When you look at the boxes as they sat there in lying, waiting for shipment, they're not in any kind of refrigeration or anything like that. They're on pallets, and they're just being transported via normal transportation. There's a great photo of a woman holding one of the boxes of vaccine as she's loading it onto an aircraft, and there's no special refrigeration in that situation. So I think my refrigerator's taking off over there. So we have, there she is. And so no, there's no special instruction in terms of refrigeration.
So you talked a little bit about this, about how, pools were drained and things of that nature. But can you talk about a few other ways that the fear of polio manifested itself in the state of Indiana?
Yeah, so as I didn't talk about it, but one of the things that we saw was, people theorized that mosquitoes were responsible. And so what you see is people were beginning to fog for mosquitoes, much like they would for malaria or something like that, because they feared that people would, contract it via mosquito bite or something like that. And so before there was a full understanding that there was, that it's, it was contracted through a transfer, and I hate to be this crass about it, but, from feces to oral contact. And, there are any number of ways in which that can happen. Obviously swimming is chief among them at the time. And so more often than not, the ways in which people dealt with, the possibility of infection would have been just by removing themselves from a public situation in which they might come in contact with it. It wasn't, rare occasions happened where saliva or something like that could have transferred it, but for the most part, it was through these other mechanisms.
Okay. And I just want to point out, and thank you for the comment in the comment section. We're talking about the Dr. Jonas Salk vaccine.
Yes, we are.
Yes.
Absolutely.
And so anything we've discussed tonight has been about the Salk vaccine. There is a Sabin vaccine as well. And if we have time at the end, maybe I'll ask you, just a quick difference between the two or something of that nature.
Sure.
But for now, more questions.
Okay.
What was the cost? Was there a cost to the person receiving the vaccine?
That's a great question. And quite frankly, I don't have the exact, numbers for that. There were costs. And I think that various states handled that mechanism separately on their own. Of course, a lot of the research that went into the early development was all done by the March of Dimes, or the predecessor of the March of Dimes, and a lot of the administration and purchase of the materials were through the March of Dimes as well. But there were also state actions. So Illinois, I think, is one state that paid for all of the vaccinations so that anybody in the state of Illinois could receive one free of charge. I just don't think it was centralized as we have, done with the COVID-19. I just don't know the answer to that exactly. I think it was more of a state by state kind of thing. And so there was cost. In fact, some people were angry. In fact, the story I told of people who were angry that we destroyed vaccine, one of their arguments was, well, you could have given those to the poor and those kinds of things. And so, like we're going to infect, poor people with bad vaccine. So, that there did need to be a mechanism for payment, and I think that varied from state to state.
Okay.
I would have to investigate that further to fully answer that question now.
Thank you. So as we look at how the COVID-19 vaccine rollout has gone, it's been by age group, it's been by profession, things of that nature. Was there something of that nature for polio? Was one group given theirs first? Did adults get the vaccine?
Adults did receive the vaccine. In fact, in that letter, she talked about her and her husband receiving the vaccine as well. But children were vaccinated first because they were obviously more susceptible, simply because they were put in positions where they came into more contact with the virus. I keep going back to swimming, and swimming was an activity that definitely lent itself to more of a transfer of, the mechanism of, mechanism of transfer of the virus itself. And so as a result of that, children were very much inoculated first, and then after that, it came to adults.
We've got a question about the polio scar. That's a smallpox vaccine, isn't it? That left a scar.
Those are usually chicken pox scars or smallpox scars or things like that.
Polio was like one shot, right?
It's more than one shot. It was actually, I think, 2 or 3, depending on the type.
Series.
I know the oral was 3.
Okay, but one needle per shot.
Yes, right. Okay. It's not like a tuberculin test or anything like that, where it's got a mass needle, or the smallpox antitoxin, would have been multiple.
Can you talk a little bit about the National Foundation for Infantile Paralysis March of Dimes items you might have in your collection? Do you have an extensive collection on that, or
Not of the March of Dimes materials themselves. You know, we do have, you know, I mean, you've seen the archive. You know full well it's, you know, millions upon millions of items.
Yes.
So, you know, so for me to be able to rattle everything off that we have just off the top of my head, I can't do. You know, we probably have some of the promotional materials that the March of Dimes, or, you know, the infantile paralysis folks created at the time. But we don't have huge store. I mean, you know, we're definitely not a repository for the, you know, National Foundation. So.
Okay. So if someone contracted polio, what could that look like? What kind of, you know, was where, yes, I contracted it, to death, you know, in many cases?
Right. So there were actually 3 different strains of the virus. And, you know, there are varying degrees of severity of infection as a result of any number of the 3 strains. For the vast majority of people who were infected with the virus, they would recover. You know, we're talking 50+% of those people who were infected would recover without any real long-lasting symptoms or indications that they were ever infected. This next large group of those people who were infected, they might have some effect to muscle tone and ability to use muscles. There was a wasting of muscles. Pardon me just for a second here, I've got a cough. And so, you know, those folks, and that the image there on the right is a perfect example of a child who was affected by, you know, infection. It very often affected the legs, and so you often see, especially with the March of Dimes materials, promotional materials, this image of the crutches and the leg braces and those kinds of things. Also with an iron lung, because as I said, it did affect muscle and muscle tone and the ability of muscles to do what it is they were supposed to do. In fact, you mentioned early on in our conversation a relative who had contracted polio, and the physical, you know, the physical
Effect.
the PT, the physical therapy that they would have used to overcome some of the problems associated with that. It's my understanding that they also use warm, wet compresses too, in order to help with the spasming and those kinds of things. So, you know, there were ways to at least have therapy for those folks who were so affected. Now, the final category of people obviously were those who died as a result of active infection. And, you know, in those instances, the virus attacks the gray matter of the spinal cord and the brain, thereby causing, you know, not only paralysis potentially, but also death.
Wow. Thank you.
You're welcome.
So I believe we have time for this. The Sabin vaccine, that was an oral vaccine?
It was.
So when people remember getting a vaccine on a sugar cube, that would have been the Sabin vaccine?
Right.
Can you talk a little bit about the 2 vaccines?
Sure. They're very different in the way in which they interact and the way in which, and you know, there has been a switch in the type of vaccine used throughout the years. So, of course, Salk vaccine, the one that Lilly produced, was the first to hit the market by quite a number of years, actually. And so the Salk vaccine was completely inactivated virus that was injected into the body that would allow the body to react to that, thereby, you know, causing an immune response that would then attack any other further infection from the virus. And it did protect against all 3 strains of the virus. The Sabin vaccine was an attenuated virus, meaning that it was very much still alive, but very much incapacitated to do, to have much of an effect on the body necessarily. And so that one was administered orally. And I think you probably were given that one as a child. I remember these little like gel pill things that they would squeeze the liquid into your mouth and it kind of tasted weird. That was that. So those were Sabin. But there were actually some post-administration infections that happened as a result of the attenuated virus running through a person's system. And so there was a possibility of infection for people around that person if they came into contact with the inoculated person's feces. And so I think today it's still an oral vaccine, but it's more akin to the Salk vaccine as opposed to the Sabin vaccine, at least here in the United States.
So we have time for one more question.
Okay.
So polio in the United States is eradicated, we'll say.
I think we can say that.
That's not true everywhere in the world, correct?
No.
So what does polio look like today in other parts of the world, or what kind of vaccines, how are they being used, if you have any information there?
Yeah, so like I said, today the virus or the vaccine itself is more like the Salk vaccine in that the vaccine itself is comprised of inactivated virus, inactivated virus, right? But we do see some infections, especially in areas such as, I think I read Afghanistan and Pakistan, some of those areas. The Americans have been, both Central, South, and North America have been polio-free, or at least been declared polio-free since 1994. And actually in the United States, even before that, sometime in the late 70s. So, it really comes down to active vaccine use in order to control this type of disease or this type of, spread. And so, very obviously parts of the world are not as equipped for not only that kind of health response, but also monetarily to be able to afford the administration and those kinds of things. So that's really what you're fighting is, poor places, poorer areas, and harder to get regions. And, who knows? There could be places that, as a result of beliefs or something like that, they might not be interested in vaccination.
Well, and we've talked about how horrible polio is tonight, and yet you said it's only been eradicated in the United States within our lifetime.
Yeah, absolutely.
So it's not like that's so long ago.
Absolutely not.
Wow.
In fact, I remember classmates who had been infected, and they, obviously had been infected because of, the wasting away of legs, and, the malformation of legs and those kinds of things. And so, I mean, that's, within my lifetime for sure.
Well, my friend, my colleague, Michelle, thank you so much.
You're so welcome.
Terrific. I appreciate your time tonight, and I'll hand it over to Mary Ann.
Wonderful.
Great. Thank you so much, Dan and Michelle, for this great conversation. I appreciate you both taking the time to share these stories with us tonight. And thank you to our participants for joining us tonight. If you enjoyed this program, we hope you'll consider coming back for more. As I mentioned at the top of the program, we have more history happy hours coming soon. Join us next week to learn about women in racing on April 29th, and stay tuned for more upcoming conversations on the WPA in Indiana and the Indy 500 Princess Program. If you're looking for family history workshops, you can join us on Saturday, April 24th, where Kurt Witcher from the Allen County Public Library Genealogy Center will guide us through how to do effective research at libraries. Sign up for these and even more virtual offerings coming to an internet connected device near you at www.indianahistory.org. Our annual National History Day program, where students conduct and share original research, has gone virtual for this year, and we need your help to judge students' projects at our contest. No previous experience is required. Find out how you can sign up and support our students at the state contest on May 1st. indianahistory.org/education for more resources there. We'll post this conversation to the IHS YouTube channel and our website in the upcoming weeks. And in the meantime, if you'd like to revisit any of our previous free programs, you can check out the History Happy Hour playlist on YouTube or at the link coming in the chat. If you missed your chance to donate or would like to make a further gift to support the Indiana Historical Society, please visit indianahistory.org/contribute/donate. Your donation will allow us to continue to share Hoosier stories. You'll get an email from us tomorrow morning with all these links and a survey included. It'll take about 1 minute to finish, and we'd love to know what you thought and how we can make programs like this better. Thank you, stay safe and healthy, and we can't wait to see you in the future.
Thank you, everyone.
Thank you.